Hello, Calaveras County. You see the shingle hanging there. The doctor is in. That is Dr. Randall Smart. Dr. Smart, how are you?
Mike, great to be here today. Thank you for inviting me.
You bet. Now, this time, we're going to talk about something that I have heard of, but I know just this side of nothing about, and that's valley fever.
Right, valley fever.
We've kind of talked about it seems like, and not necessarily here, but you hear it mentioned every once in a while. But what's going on with it?
So Mike, most people and many medical people know very little about this disease, but it's not a new problem. It's a problem that's been around a long time. And what we're concerned about as medical people is we think we're going to see more of this in Calaveras County and more of it in the mother lode.
Okay.
We could talk about why that is. And maybe even that we're already missing some cases that exist here and kind of we haven't thought of yet.
Yeah. So what is it? How do we get it? And I guess we'll go from there.
So valley fever is known as coccidioidomycosis. You don't have to remember that. And it is a fungus.
Oh, wow.
Yeah, and it's a fungus kind of like bread mold. You know, the green stuff you get on the old bread? It's that kind of fungus. It's a fungus that lives in the soil and more commonly in sand, dry, sandy environments. And this fungus is spread by inhaling it.
Oh.
So it used to be that people that would camp in the desert or recreate in the desert, what we call the Sonoran Desert, that's not Sonora, that's Arizona, Southern California. That's where it used to be endemic, it still is. And that's where being in those environments, inhaling the spores from the fungus would create a lung infection.
Oh.
And so it is this infection or disease that primarily affects your lungs.
And what is it? Well, I don't know. Where do we want to go first? Do we want to go with kind of where it is and how it's moving and then talk about what we do to treat it?
Let's do that. Let's do that.
And because you've got a map that shows, and you were telling me before we started filming that initially, and show folks the map, but you were saying that it was when you were going through, was it the training in the Air Force, and it was a little small spot on this map, and now it's kind of all over the Southwest.
So this is a map produced by the CDC, the Center for Disease Control in Atlanta, Georgia, and this is a current map, and obviously the green areas are where valley fever is, and the dark green is where it is really endemic.
Okay.
And as the green gets lighter, it's there, but less so.
Sure.
Now, when I was in training, this map included some of southern or northern Mexico, parts of Arizona, and a little bit of Southern California. It was about the size of a quarter here.
Wow.
This is a map from 2019, and you'll notice as you get up into Calaveras in the mother lode, it's green.
Well, and in what looks like maybe the southern San Joaquin Valley, there's some pretty good chunk of dark green.
Dark green, exactly. So this is new to this area and to the foothills. And so it is evolving. Now, I have never heard a real cogent discussion about why that is, but I can tell you my own personal thoughts are that part of this has to do with climate change and the fact that these areas that were once green are now becoming brown, drier, and that we're seeing more wind every year.
Which can really spread that quickly, I would think.
So that wind blows up the dust, and you get these big winds out of Southern California, blows up the dust. The spores are then in the air, and because of that, these green areas are getting bigger and bigger. My own personal theory, unpublished, unproven. Now, the other thing that contributes to this spread is the mobility our society has. So I have many patients that live in Calaveras, but they have a second home in Southern California, Bakersfield, Arizona. And so you can have people that go down for a couple months, maybe get in these windy environments, then come home and say, I'm not feeling well, I think I have a problem. So part of it has to do with climate change, part of it has to do with mobility, part of it has to do with more wind. But there's absolutely no question it is here.
And it appears that it's spreading there's no other word for it, it's expanding the territory in which it's experienced,
Absolutely
I guess we can say.
Yeah, absolutely true.
So now, when I'm not feeling good, am I going to start coughing, or how does this kind of transpire? How do we get sick?
So what happens is you inhale the spore, and interestingly enough, most infections are caused by what we call an inoculum. And so, like, if one bacteria gets in your sinuses, you don't get sinusitis. But if a clump of them, I don't know, 20, 50, 1,000 get in there, you do. And that's called the inoculum.
Okay.
With valley fever, or we abbreviate it coxy, with coxy,
Okay.
one spore will cause valley fever.
Wow.
So you can inhale one spore, windy day, maybe you were in San Joaquin County. Maybe you're in the west end of this county. Valley Springs, Burson, Wallace. One spore, and you're infected.
Wow. And so how does that, and am I using the right word? Is this a particularly virulent kind of infection? It sounds like, if one spore,
yes,
can affect you like that, it sounds particularly strong.
Yeah, the answer would be yes. It's not a particularly serious, depends on how you define it. It's usually not a life-threatening infection.
Okay.
In fact, there's even debate about treatment or whether treatment's necessary. But it can definitely knock you down, and it can definitely make it a long day or a long week or even a long month.
Yeah. And so how does that transpire when you say the patient shows up and says, I'm not feeling good, just came back from Bakersfield, but how is he, or Wallace, how is he or she feeling that?
Yeah, so about 2/3 of the patients that get coxy, they kind of have a very mild form of pneumonia. And it, in fact, can be mild enough that they don't even maybe recognize it.
Okay.
Now, we should backtrack a little bit. What is pneumonia, right?
Yeah.
So pneumonia is a lung infection, and the way it's diagnosed, in addition to cough and fever, is something abnormal on your x-ray. So if you have those three things, if you have cough, fever, and something abnormal on your x-ray, you have pneumonia.
Okay.
Now that doesn't mean you have bacterial pneumonia.
I see.
It doesn't mean you have viral pneumonia or fungal pneumonia. It just means you have an infection in your lungs.
Okay.
And we refer to that as community-acquired pneummonia. That's what the docs call that, community-acquired. There's other kinds of pneumonia, like you can aspiration pneumonia.
Yeah, that's right. Okay.
Yeah, there's other kinds of pneumonia, but this is called community-acquired pneumonia. And so many of these patients may simply have a cough, maybe not feel well, be a little bit achy, and maybe not even go to a doctor, or maybe go. But there are kind of some red flags where we would think, this might be valley fever.
Oh, really? Okay. What are those?
Well, one is that you're in an area or have been in an area where, it's on the green map. But in addition to that, people with coxy tend to be achy. They get really achy. Their joints ache. And the joints typically are symmetric. They typically are large joints, but not always. They can definitely be your hands or your feet. But you have symmetric joint pain. And in fact, there is a phrase called desert rheumatism. You've probably not heard of that.
Nope, haven't heard that one.
Right. Desert rheumatism is another name for cocci.
Okay.
And that's because these people in the desert, we get swollen hands, like
man.
rheumatism, rheumatoid arthritis, swollen knees, tends to move from joint to joint. So somebody who has respiratory symptoms has been to the green areas, and maybe they're achy and have joints, then you start going, and then if you have skin rashes, that's even more compelling because often there are rashes associated with this. They have big, long names. We won't go into that.
Cocci was enough for me.
Right. So anybody who has skin rash and pneumonia, man, a bunch of red flags. That's probably cocci. Headaches are common. 20-30% of patients will get headaches.
Okay.
Now, lots of things cause headaches, right? So that's not diagnostic.
Yeah.
But those are the kind of symptoms we see. And again, 2/3 have this kind of community-acquired pneumonia presentation. And those guys sail through this without a lot of doctoring or a lot of treatment.
Oh, okay.
But one of the problems those 2/3 get into is a doctor will see the patient, will take the x-ray. The x-ray shows a pneumonia, and so they end up on all these antibiotics.
Yeah.
They don't get better very quickly. They're taking lots of antibiotics. Antibiotics have complications.
Yeah.
And nobody ever said, maybe it's valley fever.
Yeah.
Maybe it's cocci. So even though those 2/3 do really well, if they have connections with the medical system, often they are undiagnosed.
Okay.
And often they are on antibiotics they don't need and don't work.
Yeah. What does treat this? And I know you said that there's even some discussion or disagreement as to whether we treat it, but you just bleach out the lungs?
No, people recover, Mike.
Wow.
People get through this and recover. And if you're those 2/3 that have relatively mild disease, you don't necessarily need any treatment. You do need some things. You need some support.
Okay.
You probably need to go home and go to bed. But when you do go home and go to bed, you have deconditioning, your joints hurt, you don't use them.
Yeah.
Suddenly you're losing muscle mass and you're becoming weak. So support includes things like physical therapy, breathing exercises, but it doesn't necessarily include antifungal therapy.
Okay.
Now when we consider antifungal therapy is when they start developing a more serious syndrome.
Okay.
Maybe they're hospitalized. That alone would make me use antifungal therapy. They may be progressing, not getting better, getting worse. There are pulmonary complications where you can form cavities in your lungs.
Oh my gosh.
And probably those folks should be treated. You can develop fluid in your lungs. We call those pleural effusions.
Okay.
And so as you develop some of this more serious stuff, then the antifungal therapy is recommended. Sometimes that's done by specialists, infectious disease specialists. Sometimes it's done by the primary care doc. Internists are capable of doing this without a doubt.
Okay.
But there is a line that if you go over, then being on antifungal therapy is the right thing to do.
As someone who has contracted valley fever, am I going to feel short of breath and that kind of thing? Or is that when it's getting fairly serious and that's a definite go to the doctor?
No, you're right. Anything that infects your lungs can cause lung symptoms. So the most common symptom is cough and malaise.
Okay.
With or without fever, with or without headache. But you can definitely have some shortness of breath. You can definitely have some pain. Like if I take a deep breath, it kind of hurts.
Oh, yeah. Okay.
You can have pain. So right, those things can occur. And then where we really get concerned is there are a subset of patients that really, really get sick.
Well,
I mean, they really get sick.
I would imagine folks who have compromised respiratory systems anyway would be at a worry for this.
Sure.
But,
Yeah, exactly. If you had emphysema
yeah.
or asthma or any of the chronic respiratory diseases, I mean, this would be harder for you.
Yeah.
It'd be much more difficult for you. The patients that really get into trouble are the patients that are immunocompromised.
Okay.
Their immune systems are not up and running. And part of that is our fault because they can be transplant patients
Yeah.
who are on medicines to knock back their immune system. So heart transplant, kidney transplant, bone marrow transplant, those liver transplant, those guys are definitely susceptible. Much more of this in that population, and frankly, much harder to treat, and always antifungal therapy.
Oh.
There are also pregnant patients
Oh, okay.
have a tougher time with this. African Americans have a tougher time with this. We don't know why.
Okay.
I can tell you a story about that, actually. And so some of the chemotherapy patients, some of our cancer patients that are on chemo, are more susceptible. But in most of those scenarios, this is a treatable disease. And what I mean by that is if somebody asks the question, and they do the test, and there are tests, and they're on the treatment, then often the outcome is favorable.
I was just going to say, is it a blood test that determines you've got this? Or, I mean, the x-ray is going to show you the spots on the lungs, I would think, but that doesn't necessarily tell you this is cocci, right?
No, it does not. So a lot of times when patients have pneumonia, one of the most useful tests can be just having them culture their sputum.
Oh,
So we have them kind of bring up the green stuff,
yeah.
and we can often culture out of that. Sometimes out of blood cultures, if they're sicker,
Oh, okay.
we can culture the organism out of their blood. But for cocci, those cultures, they can be positive. They're usually not.
Oh.
If they are positive, it's totally diagnostic.
Yeah.
But usually the diagnostic strategy is a blood test that looks for antibodies.
Oh, okay.
And so that makes it a little bit challenging. I'll tell you how in a minute. But we can identify these antibodies. And if they have antibodies and they have the symptoms in the x-ray we described, they have cocci. That's it. That's all you need to know. Now, the blood tests can get a little more complex. There's a different set of blood tests for following them clinically. You know they've got it.
Okay.
You've done the tests. But now you're trying to figure out, are they getting better?
Are they getting better?
Worse?
Sure.
And that's a different set of blood tests. I won't go into the
okay.
immunology of that. But those tests are available. They're available in Calaveras County, or really any hospital, or really any clinic. So those tests are available. And, the problem is we haven't thought about this in a long time because this area is only newly green.
Yeah.
And so...
That's what I was just going to ask is, have we seen many cases here in Calaveras County? Is this something that,
we don't know.
Doctors report? They're not, so you're not, and I forgot what those are called, but those diseases that you're required to report.
You are required to report.
Oh, you
this.
are? Okay.
Yeah. But
it's a matter of finding it.
Right. You can only report it if you've said, maybe they have it, maybe I'll do the test, positive test, now I report it. So guess what percentage of people in one of these green areas that present with a pneumonia actually have valley fever?
I would guess that most of them have what we call pneumonia and they're not thinking...
Exactly.
Yeah. And so how many do have valley fever?
You have to guess.
Okay, so we're still guessing. Wow, that makes it tough being in your shoes as the doctor, doesn't it?
So if you're in the dark green area and you present with pneumonia, 30%
Really?
have
Wow.
valley fever.
Okay, so
If you're in Arizona, where it's dark green, or
Yeah.
Bakersfield, where it's dark green,
that sandy, dry dirt.
that number is thought to be pretty close to 30%.
Wow.
If you're in the lighter green area, 10%. But even 10%, Mike. You know, if you think about Calaveras, Samador, Tuolumne,
Yeah.
10%, man, that's a lot of people.
Yeah, that's 4,000 people in Calaveras County.
And what everybody will say is, well, I had pneumonia, the doctor treated it, it took a long time to get better. The antibiotics didn't really seem like they did a lot. It's probably valley fever. Probably what it is.
Now, I think I know the answer to this question, actually, not because I've been reading ahead, but is there anything we can do to prevent getting this if we're going down to explore the oil fields in Bakersfield or...
Yeah, tough question. We really don't know. So if you were a transplant patient going out into the Arizona desert, the first thing I would say is there someplace else you could
Why? Yeah, wouldn't Hawaii be nicer?
But we can circle back to that question from some of my military days. But the second thing I would probably recommend is stay away from really dusty areas. Try to find an indoor environment if you can. And if you are outdoors, wear a mask.
That's what I was thinking is the best you can do is put the mask on and hopefully try and filter most of it out.
And then if you come home, just make sure your doctor, if you get sick, I didn't mention this actually, the incubation period is 1 to 3 weeks.
Oh, that's I did forget to ask that too. Yeah. That's actually fairly long, isn't it? No?
But standard, but it's not 6 months.
Yeah.
So if you haven't been in an area in 1 to 3 weeks, it becomes less likely.
Yeah.
Actually, we just saw a case like this down in the New Valley Springs Clinic. And we were pretty sure she didn't have it, mainly because she didn't have the travel exposure.
Hadn't traveled. And this is maybe a dumb question. Again, I think I know the answer, but this isn't, or is it transmittable between us? Like if a relative gets sick?
No. You could use it as an excuse if you don't want to see the relative, but you know, there's no, there is. But the interesting story I was going to tell you is the first case of cocci I ever saw. I was in the Air Force. I had a long career, and what the military would do is we would send people out for training. And one of the areas we would train is in the Arizona desert.
In the middle of the desert.
Right. And unfortunately, we would send African-American soldiers, we would send pregnant soldiers, and they would set up tents and do exercises and come back home. And we would see this, not every week, but definitely throughout the year, we would see it. And we finally said, you know, maybe training in the desert is not such a good idea, or maybe we could find a different desert to train in. Yeah. So we kind of created this problem. Not the entire cocci problem, but within our Air Force personnel, military personnel, we kind of created the problem by sending them into the desert, and then they would come home.
You know, and after looking at that map, it just dawned on me, is this fungus elsewhere on the planet? Is it in other deserts?
I don't know, and I don't think so.
Okay, interesting.
But it's also interesting if you look at this, you'll see there's some in southern Washington.
A little dot up there in
southern
Washington,
right? And there's some up here. I believe this is Idaho, isn't it?
That's Utah.
Right?
Yeah,
I'm sorry, Utah.
Around Salt Lake.
And up here in Northern California, look at that. Up around Red Bluff, Redding.
Yeah.
So, and I will bet you, and I usually win these bets. If you looked at this map in about 5 years, it would look something like this.
Be light green all out there.
It would look something like that. Yeah, exactly.
Do you have any idea where the name came from? I mean, San Joaquin Valley, is that where it
from the valley
came from? The valley fever.
Yeah, because it was actually the I believe the Bakersfield area, which is part of the San Joaquin Valley, and the folks down in the Bakersfield area would. I mean, if you go to a clinic in Bakersfield with a respiratory symptom, they are all over this.
Yeah.
I mean, they've been doing this for years and years. So that's where it came from. But it's never been this far north.
Yeah, yeah.
This is really new for us. And I had a good physician friend say, back during the blackouts that we had recently, said, with all these winds, we're going to see valley fever. And I said, what about the blackouts? I mean, aren't you worried about it? He says, no, man, we're going to see a lot of valley fever. And he's a very bright guy, and I think he's absolutely right. Yeah.
Yeah. Now, if one or two patients present, say, in a month, does that indicate that it's moved up here? Or do we need to see lots of people diagnosed with it over the course of, several months?
Yeah. If you see one case, you get much more vigilant. It depends on their travel history.
Okay.
But if they say, no, man, I've been in Burston and Wallace for the last 2 years, that's definitely reportable, and it definitely gets your attention. And then what tends to happen is our colleagues in the public health department tend to say, wait a minute, let's talk about this.
Yeah.
They don't have that travel history. And then maybe you see a second case, and that's true with any disease. And if you see a second case, people really start paying attention, and that'll happen. I think the real message I would like to get out today is it's probably here.
Yeah.
And there are two ways we could do better. And one is the patient could say to the doctor, do you think I have valley fever?
Could it be? Yeah.
Not a bad question. And the second thing is the doctor could say, we should probably test you for valley fever.
Yeah, let's look at this.
Those two things are not really happening.
So it's a little bit patient advocating for him and herself.
Carefully.
And a little bit the doctor tuning up his or her senses a little bit.
Don't intimidate the doctor.
Oh, I know that.
Right.
Just ask the question gently. Just a suggestion. So, for a change, we don't have to exactly watch what we eat, folks.
Isn't that great?
It's the first episode we've done in a long time where we don't have to slim down.
This is not about your weight.
This is not about
I want to go on record.
Yeah, there you go. So, if you're having some trouble breathing and kind of feeling run down, maybe it's valley fever. Take a look at it.
Joints
too. Keep
rash.
an eye on those. And the rash. If you got the rash, you probably got valley fever. Folks, Dr. Randy Smart, thank you very much.
Thank you, Mike.
Until next time, ladies and gentlemen, I'm Mike Taylor. The doctor's out.